South Africa has become the first African country to register the revolutionary twice-a-year anti-HIV jab, Len. Now, the jab, which could start rolling out as early as February, is almost 100% protection against contracting HIV through sex for HIV-negative people weighing 35 kg or more. The jab is injected into the fat under someone's skin once every 6 months. Now, Mia Malan, editor-in-chief of Becky Sisa's Center for Journalism, joins us to discuss this game changer. Mia, good afternoon. Welcome to eNCA. South Africa, the first country in Africa to approve the twice-a-year HIV prevention jab. Just how significant is this milestone for the continent?
Well, it's really significant. It's also, while it's the first in Africa, we're the third country in the world. Only the US and the European Medicines Agency have approved it so far. So we're really doing really quite well in terms of speed here. If you look at how fast our medicines regulator, SAHPRA, did it, they took about 65 days, which is, to put it in context, 10 days faster than what we took to register the J&J COVID vaccine, which is the vaccine during COVID that we registered the fastest. Now, the reason why it's so significant is because scientists see this jab as a potential game changer to bring down new HIV infections. And the reason they see it that way is because you have to take it once every 6 months. So adherence is not such a big problem.
Well, the rollout will start very small. We're talking about 450,000 people in high-risk areas. According to what you know, what will determine who gets it first?
So that is a contentious issue at the moment, because doses for 450,000 people, that will be over 2 years. We're buying it with Global Fund money, our first phase of our rollout, those doses. Those doses we have to use very carefully because they are so few. To give you the context of why they few, is that modeling studies show us if we want to make a huge dent in new infections, we need to put between 1 million and 2 million HIV-negative people each year on this jab to make a huge dent. And if we do that, then we could end AIDS by 2040. Now, in the first 2 years, we only have 450,000, enough of it for 450,000 people. So scientists have different ways that they look at it at the moment. The group that gets the most HIV infections in South Africa at the moment is teen girls and young women between the age group of 15 years and 24. But it doesn't mean that they necessarily the group that we need to start with. Many modelers argue that we should rather start with pregnant women and breastfeeding women. And the reason for this is they have a very high HIV infection rate. They're a smaller group, but many of them are also teen girls and young women. But the main reason is it's easy to find them because they naturally all come to two places, either vaccination clinics or pregnancy clinics. You don't have to go and look for them. So it's easy to find them, to give them doses, to test them if they're HIV negative and ask them if they want it. And it's also easy to follow up with them.
Len replaces 365 pills a year with just 2 shots. And one would be thinking that everybody would be very eager to get the jab. We know how, especially South Africans and many on the continent, feel about just the word jab, especially after the COVID-19 vaccines. The question is, how much education do you think will need to be done to get everybody on board?
That's a very good question, generally, because it doesn't mean because we've got a jab that can work that people will just magically use it. We would need to create demand for it. And also people need choices. We know that from contraception. The more options you give people, the more likely they are to use one of those options. It's the same with HIV prevention. So we will have Len, which is a jab, but it doesn't mean we're not going to offer people the pill. Some people like pills. Some people find it hard to take a pill each day. And because this is not a vaccine, if you don't take that pill each day, it works less well than if you were going to take it 3 times a week. Then you don't get the protection you want. With a jab, the excitement is around the fact that you don't have to, that it's easier to adhere to. They are early data that we have. In theory, there's a study at WITS that they did. They asked people who already used HIV prevention methods, if you were to get a choice, between the pill and the jab, what would you take? And there was quite a significant number of people who showed an interest. But to really see how this is going to play out in real life, we have started at Wits University and the University of Cape Town with 2 implementation trials this month to see, do people like it? Where do they want to get it from? What are the type of people who would take it? And how long do they stay on it for?
Well, cost and access remain concerns as well, especially with no generics until at least 2027. Your thoughts on that? Could that slow down the fight to end HIV and AIDS and perhaps the implementation of this jab?
So the company that makes the drug is called Gilead Sciences. So that's the originated drug, the branded drug that will cost a lot more than generics. Now that company, Gilead, did give 6 generic companies licenses to produce generics. And as you said, it would become available in 2027. That sounds like a long time, but in the research and development world, that's actually quite a record short time to make these things available. So when it comes to price, we don't know in South Africa what is the price that they will sell it to. We are getting our first phase for the 450,000 people. It's the Global Fund buying that drug. They're not telling us the price of it, and we're using our grant. They tell us to use $60 per person per year. But when it comes to generics, if there are many companies producing it, there's competition and prices will go down. And we already know that there are 2 companies of the generic companies that the Gates Foundation and Unit Aid will help to produce the Len injection at the same cost as the daily pill, at about $40 per person per year. And as we go along and as doses increase, prices are likely to go down more. Our health department has already indicated that they prepare to use health budgets to buy more doses than the Global Fund doses that we're getting from 2027 onwards, so that we can increase the number of people that we have on Len.
Mia, in conclusion then, once again, just to put the minds of South Africans at ease, we are the first on the continent, but you mentioned earlier, 3rd in the world. What has been the side effect, some of the studies, just anything that you think is important for South Africans to know, and as far as the outcomes in the other 2 countries where it has been implemented, just briefly?
So from studies is really where we know the side effects from, because, in the US and in Europe, it was only approved in the past 3 months, right? So we don't really have a lot of data from there yet. And studies, the most common side effects were, what you get when you get a jab, a little bit of swelling, red swelling around the site of injection, maybe a little bit of inflammation. And in the case of Len specifically, some people get nodules, little bumps where the injection sort of like is where the Len is stored. Remember, the reason you only have to take this once every 6 months is because it releases itself slowly into your body. And the nodules is one of the things that some people get as a side effect from that, but it doesn't stay there forever. It eventually disappears.
Really do appreciate your time and a little bit of education. Thank you so much, Mia Malan, Editor-in-Chief, Becky Sisa Center for Journalism.